Line of the aorta, right here. There's a humongous artery that comes off of it. It's called the superior mesenteric artery. It's like right here, kind of pink. Okay? It's a huge vessel, and it basically supplies all the small intestines with blood. And all those little tributaries that come off are called mesenteric arteries. So if you can imagine a 23 feet of small intestine all coiled up in here, that's how the small intestine gets its blood flow. The irony is there are also colic arteries that come off this to go to part of the large intestine or the colon. And I think it's like actually helpful to understand the parts of the colon. The ileum is the final part of the small intestine. It empties into the large intestine or the colon right here. The large intestine begins with the cecum, and then it continues as an ascending colon, a transverse colon, a descending colon, a sigmoid colon, and a rectum. Cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum. So, if the superior mesenteric artery is here, what are the colic branches that came off of it? That one, and that one. And they're the middle colic artery to the transverse colon, right colic artery to the ascending colon, ileocolic artery to the ileum empties into the colon. It's not hard. Okay, so superior mesenteric artery, most of its blood goes to the small intestines, but some goes to the colon. Middle colic, right colic, ileocolic. Might as well continue down to the inferior mesenteric artery, right here. That comes off. It forms like two main branches. Those two there are the left colics. I usually point to that, but that's a sub-branch off of it. That's going to go to the descending colon. This branch is the superior rectal. Some people say the superior hemorrhoidal. That comes down to the sigmoid colon and the rectum. Here we have the end of the aorta. It bifurcates into the two common iliac arteries, right and left. And we might as well just follow those down. The common iliacs bifurcate into external iliac, internal iliac. Internal iliac goes to the posterior, like buttocks area and so on. External iliac is going to head into the leg. Coming off the internal iliac, we have a little iliolumbar. It's shown pretty well on this chart. It goes to the iliolumbar part of the back. I'm going to flip over to here. Aorta end, common iliac arteries here and here. Let's follow the left one. It bifurcates into external iliac, internal iliac. External iliac comes down into the pelvis. It bifurcates into femoral and into deep femoral. Now the deep femoral goes very posteriorly in the leg. It supplies the deep tissue. The femoral is more medial. You can actually feel that or palpate it. Like you can palpate a person's pulse in the femoral artery. You can take the blood pressure there too. And then as the femoral gets into the knee area, we change its name to popliteal because the cavity on the back of your knee is called popliteal fossa. So if I put a pin here and say name this artery, name this vessel, it's femoral. If I put the pin behind the knee, I want you to call it popliteal. And then if we drop down to the lower leg, the popliteal is going to split. Three branches. And here's the trick to that. You locate the tibia first. Coming off the popliteal, you're going to have a branch that goes down to the anterior part of the tibia. That's the anterior tibial. The most posterior branch is the posterior tibial. And the branch that disappears to the outside of the ankle, where the fibula is, fibular or peroneal. Okay? So it's common iliac, external iliac, internal iliac. External iliac bifurcates into femoral, deep femoral. Femoral becomes popliteal behind the knee, and that's going to give rise to three tributaries: anterior tibial, posterior tibial, and fibular or peroneal.
What is that one again?
Disappears to the outside of the ankle. Like if you're looking at a person's leg from the medial side, you're not going to be able to see the end of the fibular artery because the fibula is on the outside.